Good morning. Happy Tuesday. Welcome to this week's edition of Not Your Normal Healthpreneur. I am your not so normal host, Benita Amos, working to be a healthy gorilla. Not Your Normal Healthpreneur is a weekly show for health practitioners who are looking to start and grow their natural health business. This show aims to help these businesses increase their exposure and reach, to better help their clients and thus increase their income. Our intent is to connect like-minded health practitioners to share strategies and knowledge, to inspire newbies and wannabes to accept the call to action, to encourage collaboration and cooperation among all practitioners as we continue to create the health modalities of choice for the future. We are keen to help health practitioners gain more clients, to grow their business, to acquire more tools to help more people, and in the process to give people education and insight into some of the natural modalities that are available out there and where they might turn to for help as an alternative to, say, settling for mediocre health or resorting to the potentially invasive medical procedures that are the norm today, or the taking of pharmaceuticals with their potentially harmful side effects. Ultimately, we want to show how challenging the current healthcare system can work to create more profits by helping more people. So it's a win-win for everyone. So our guest this week is Dr. Natalie McLeod. So Dr. Natalie is a chiropractor, my chiropractor, who I would say I'm very grateful to have had along my own healing journey. Welcome, Dr. Natalie.
Thank you.
So tell us a little bit about your current practice. What kind of services and products are you currently offering?
So at my clinic, obviously the number one thing is the chiropractic adjustment,
Right.
but we also offer laser therapy services, massage therapy services, and I do a lot of nutritional consultation. So there's lots of supplements, and I deal a lot actually with gut health.
Interesting. So laser therapy, I know I've had some treatments, not necessarily at your clinic, but what do you work on with people for laser therapy?
Oh my goodness, lots. I mean, the biggest thing it's known for is strains and sprains,
Right.
Injuries. I mean, you can do a lot of chronic conditions too, like chronic back pain and neck pain. The biggest thing is, I don't know if you're aware of Cochrane Review.
Mm-mm.
These guys, like, so in terms of research, the Cochrane Review are kind of people that almost try to make sure that nothing's not working. So when they say something actually works, it's like a huge thing.
Oh, okay.
And the Cochrane Review couldn't believe how well the laser therapy actually works for shoulder issues in particular.
Oh, nice.
That was the biggest Cochrane Review they did for it. And I find so many people have shoulder issues too. Like the laser therapy has been doing really well for that.
So shoulder issues because we're sitting hunched over a desk all day?
Partly. That's part of it. I mean, remember, it comes down to how well you're adapting to stress in the long run.
Right.
So I like to use the laser therapy more as an adjunct to the chiropractic care because you want people to have prevention in the first place. Then I actually find they don't need as many treatments with the laser therapy because their body's already processing the information better in the first place.
Right.
Compared to somebody who's coming in who has never had that done and then also like would need the laser therapy. For example, like I have somebody who's a triathlete and he takes very good care of himself.
Right.
He doesn't really have chiropractic care at all. He came into the clinic because he was referred, and then we've been putting the laser on it. And I'm finding usually with my regular patients, it's 3 or 4 visits, and with him, we're at 5 or 6 before he noticed the change. So your body's just, I mean, it adapts better when you have a good brain. You need a brain, right? When you have a good brain and spinal cord. I just find that those people actually get better faster.
Well, so let's circle back to this there because we talked about laser, but let's talk a little bit about this because I know this is like years of training, but let's talk a little bit about the science of chiropractic and how it helps.
Oh yeah, see, now that's what I love to get into.
Yeah.
The thing is that a lot of people talk about evidence-based stuff right now, and there's been more of a, actually, I'm glad to say that there's more of a patient-centered approach to a lot of things right now, which is good because it should be about the person and what they want.
Right.
And they're trying to change the whole evidence-based to more evidence like informed practice because it depends on your clinical experience as well, not just whether the research shows it or not, because everybody's going to react slightly differently to something, right? Everybody's different.
Yes.
So the biggest thing when it comes to chiropractics, and there's lots of research right now that I'll expand on a little bit, but the biggest thing I like to tell my patients is D.D. Palmer, the modern chiropractic, He discovered chiropractic based on tone. Everything's frequency, everything's vibration. He was actually quoted at one point back at the beginning of the 1900s. He actually wrote a reply in a medical journal to a question they had on, if we could figure out, why people get sick or disease
Mhm.
processes and things like that. He actually wrote, well, nerve vibration is associated with consciousness. There's your answer. So I just find it interesting because I keep researching everything because you know what I'm like. I like to
Yes.
research and see what everything is going on.
Right.
And you can go way back. Like look at Hippocrates. Look to the spine for the cause of all dis-ease. And yet we got rid of the hyphen. And now things are disease processes, right?
Yes.
Or
Yes.
syndromes.
Yes.
And it's like they understand that there's an innate intelligence in the body and you're meant to heal. You are.
Yes.
Right? So that's where that premise comes from in chiropractic. So chiropractic is an art, a philosophy, and a science. And now I think the science is actually just starting to catch up with the philosophies and ideas that they actually understood like 100 years ago
Right.
or greater, because Hippocrates was around hundreds of years ago.
Yes.
So when we look at the current research, I actually love two people in particular that are doing a lot of research.
Mhm.
So the type of adjustment I do at my clinic is more instrument based.
Yes.
That's because Dr. Holder at the Holder Institute, he does research and he actually helps people with addictions. So the substance abuse people in particular, he actually runs an addictions facility in Miami, Florida. And so he's been doing a lot of research, and that's where he got this instrument to show that an adjustment actually helps increase the well-being of the human frame. And so the FDA looked at this research and then actually approved this instrument, which was a huge thing for the chiropractic profession.
Right.
So he's been doing lots of research in that aspect. Then you have Heidi Havoc. She's, if I remember correctly, somewhere in New Zealand or Australia. Don't quote me. I hope she doesn't watch this because she's probably be mad at me if I don't remember. But she's brilliant. So she's a
That part of
chiropractor.
the world.
Yeah, exactly. Yeah.
Yes.
Well, what if somebody over there listens to this? She's brilliant, absolutely brilliant.
Right.
And she's a neuroscientist, but obviously she went through chiropractic college. So she's a chiropractor. She doesn't practice chiropractic anymore because she's doing more of the research. And so she's been researching all this and showing what occurs after an adjustment and how well it helps sort of normalize the nervous system and what it can do for the body. So I feel like we're finally getting some of that information out, and I hope people learn about it. Because as you know, it's not, it's funny when somebody comes in because they're like, oh, can you help me with this? Well, I know it's help you, but whether that goes away first or something else goes away first, I don't know, because it depends how your body heals, right?
Yes. Yes. Well, the body, I mean, there's so many points that you bring up, the whole body healing, right? The body decides what the number one priority is when it comes to healing, right?
Absolutely.
So what you're doing with putting the spine back into alignment is you're saying, okay, well, we'll take this away and allow the body to make that decision so that there's no other interference that it has to deal with, right?
Yeah, exactly. So by taking away that interference or what we consider that messaging signal that's not optimal,
Right.
I make sure that circuitry works optimum that it can,
Right.
and then your body adapts whichever way it needs to.
Right. Yes.
Yeah.
Oh yeah. And yeah, the whole thing about, the body is designed to heal. It's like it is. I mean, I was given an example a while back. They said, like you cut your finger, right?
Yeah.
And you can watch it. You could literally watch it heal itself with no outside intervention, because the body says, oh, okay, well, we need to send whatever it is we need to send, the tools to actually help it heal. And that's where this is why I get so excited about anything that I term to be natural modalities, that I view as a natural modality, is all we're doing is helping the body to get better back in balance so that it can say, okay, well, instead of concentrating my resources over here, I'm actually going to go to where it's actually needed for healing.
Yep.
So what was the catalyst for you to start your business?
I thought about this.
Uh-huh.
When you sent me the question, I was like, oh my goodness, there is so many catalysts. Because I could go through why I went into chiropractic in the first place, and then from there setting up my clinic. So I think people need to know a little bit of a background on me, because I was sick as a child. I was actually kidnapped as a kid. And then I realized later, long story. I'm not going to bore everybody with that. So long story short, I was on at least 6 to 12 puffers a day between the age of 10 to 12, asthma, bronchitis, like sick, you name it. And then I just woke up one day when I was like 12 and looked at my mom and said, like, I can't do this anymore. Like, I can't.
Mm-hmm.
And I just told her, I'm done. I'm done with all this cold turkey. Don't ever take me back to, the hospital. I can't do this anymore. This is not a life. and then moved on from that. I was actually anorexic in my 14, 15s. And it's interesting how you go through something, and I totally understand you're in the middle of a tornado. And then you start, I mean, for me, I just think the human body is absolutely incredible. Like we've
Yes.
just scratched the surface as a species. I think like
Yes.
the 21st century, we should know something. And
Yes.
yet it's like, we know nothing.
Yes.
And we have to be honest about that. That's why when I talk to my patients, it's like, I will always tell you whatever I know. I make it my job to make sure I know all this for you so you can make whatever choice you feel is best for you.
Right.
And so for me at that point, that was the only thing that I could do. And I wanted control of my life. And that's another reason why I did my addiction certification, because I was anorexic and it's a different mindset at that point. And so I understand where patients are coming from with some of the mentality too. Because remember, the body's going to follow the mind. And that's where that central nervous system kind of circuits through what's the mind talking about, what's the mind doing, because the body's going to follow that info. That's where the central nervous system is connected. So, you know, now that I'm looking back at what my history was when I was younger, it's incredible. And then in my mid-20s, I ended up having horrific menstrual cycles. This is where I started studying more to do with digestion and those issues. And that led me down the path of traditional Chinese medicine, actually, because no matter what I tried, Western medicine, naturopathy helped me a lot, but it got me to a certain point. And then for me, it was homeopathy and traditional Chinese medicine that actually solved the rest of the issue. And I mean, it took me a good 10 months just to get all of that resolved normally. Because the only suggestion the medical profession gave to me at that point was, we're going to take out your uterus and ovaries. And I'm thinking to myself, I'm 24. I'm sorry. Like I want a choice to have children later. There's got to be another answer.
Right.
And I'm happy that I searched for it, because they unfortunately at that point didn't give me that option. Though later on, when we talk about who you talk to in the community, the great news is there's a lot of different professions now that understand that we can collaborate a lot. I just feel that obviously everybody's on a different journey. And for me, like I look back now and I think, oh my goodness, like now that I look at my patients, I know exactly what you're going through. Like I went through that myself. And that's why I always want to make sure they have all the information that they need, because I didn't have anything at that point.
Right. Yes.
Yeah.
Well, and again, that goes back to, and I mean, that's part of my healing journey along the years too, is the fact that when we look at the current allopathic system, it's drugs and surgery.
And then that's what they gave me. So what ended up happening with that is, randomly, there's a chiropractor next to the grocery store I go to. And I had been having horrific migraines and stuff too. And he advertised, helps with. And I thought, well, I got nothing to lose, because I mean, other than taking medication to get through a day right now, I might as well see what he has. And within 3 months, I mean, and it was a high care plan. And I understand, because I had a lot of stuff going on. Within 3 months, I was not taking anything, no migraines, feeling better. And after that is what led me to the homeopath and traditional Chinese medicine. But after he explained to me that the nervous system functions and the brain, the body follows the brain, I thought, this is brilliant. Why aren't people learning about this? And so then I quit my master's PhD program and went to chiropractic college. And that's where it started. Yeah, that's where it started. And then after that, when we get to later questions on what should somebody know if they go into this profession, I mean, I hate to say it, but and it's the same in every profession. Some people are going to take advantage of you. Some people aren't. And unfortunately, I was taken advantage of. And I got to the point where it's like, I can't be in somebody else's clinic, because I feel like I'm very true to the philosophy as well as the science. And so then I almost felt like I was forced to have to set up my own clinic. And I mean, it's been the best thing ever since. So that's how, in the end, I ended up setting up my own clinic.
Feel your excitement from here.
Oh, good. I'm glad. I mean, now that, you don't really think back sometimes, but I really hope that people do look back, because you're never the same person.
No.
Those experiences really shape you, and you learn what it is that you need and want to do in your life. And that's what matters.
Yeah. Well, yeah, quite interesting. We'll touch on this some more here. So let's talk about who is your ideal client?
Oh, see, I thought about that one too. So ideally, honestly, one, I love my pregnant moms, because there's so much to gain by getting chiropractic care in pregnancy and balancing that pelvis and knowing that they get such a better birth outcome. And that's what the research has shown too.
Nice.
But for me, I would love people, even if they don't have symptoms, to start chiropractic care.
Right.
Because it really is, we're looking at more prevention and better quality of life.
Yeah.
So for me, when somebody comes in and goes, somebody said that, you do a certain technique and I don't really have any problems, I just want to get checked. That's the best. That's
Hmm.
fantastic, because it's not like I have to start a care plan that's really intense depending on if you're in
Yes.
acute pain. Now
Yes.
we can just move on with, great, your body's doing quite well right now. Let's just help you adapt to other stressors in your life so you can have a better quality of life.
Yes. Yes. Maintenance or prevention are always easier options than trying to
Yeah,
recover, right?
absolutely.
Well, I wish I would have known about chiropractic way back when I had my babies, because I remember during my pregnancies, towards like I would go out for walks, right? But towards the end of my pregnancies, I couldn't even walk. My lower back was so, I don't know what it was like, but I wouldn't have even thought like the idea of going to a chiropractor would have never even occurred to me.
Yeah. Well, I'm glad more and more people know about it now too.
Well, it's like I think too. It's like yeah, what, yeah, coulda, shoulda, woulda, right? There's no sense. There's no
Okay, water
sense.
under the bridge. If you didn't know,
Yeah.
you didn't know. You can't blame yourself for that.
No, but yeah, wonder what difference it would have made. So let's talk about this. I mean, who's your ideal client, but what challenges do you help your clients with?
I'm everything. I was trying to figure out how you wanted me to be more specific with that one, but I mean, I get everything. I get migraines. I have cancer patients that we help, if they decide to do chemotherapy, just obviously they feel a little bit better after. That makes a
Mm.
huge difference because that's, like I said, the body follows the mind. If they feel a little bit better, that's better for them. I have knee injuries, shoulder, neck, low back pain. I get digestive issues, IBS, Crohn's. I mean, people tell me what they have. It's not that I treat that. You know what I
Right.
mean? It's just
Yes.
I'm helping their whole body just function better so
Yes.
that all these other issues feel better and get better. And that actually leads me to the other one, where, like, who do you work with? I work with a lot of other healthcare professionals
Hmm.
because I know that depending on what somebody's issue is and depending on how long they've had it,
Right.
like, for example, I have somebody in their 70s and they've had Crohn's since they were 20. Well, there's certain things, unfortunately, at that point we must do based on matter,
Hmm.
right? There's physics in here at play too. We can't be, you know, we have to understand what we
Yes.
know. And
Yes.
so for that individual, I might be working with whoever they have as part of their healthcare team. What
Hmm.
matters to me is that that person, like I tell them, is having a better quality of life. Because if they can't
Yes.
sleep and all of a sudden they're sleeping, that's a
Yeah.
huge difference.
Huge.
Yeah.
Huge. What's interesting, this was years back before I started seeing you. I was seeing another chiropractor, and I had, well, I run.
Yeah.
I also injure myself when I run. And I had sprained my ankle one morning, and it turns out I had an appointment with my chiropractor that very morning. So I went in to see him, and I said, I don't know if I'm in the right place, like if this is the right thing or not, right? And he said, you're absolutely in the right place. Like
Hmm.
chiropractic treatment for a sprain. And again, I never would have made that connection, even though I had been seeing a chiropractor for years. So if people know that that's an option as opposed to, just the standard rice, right?
Yep.
And it made a huge difference in my recovery. Was I kept going back for regular treatments on that ankle, and I've suffered sprains before, so I know how long they can take to heal. This was a huge difference for me.
Hmm. Yeah,
So
absolutely. So, yes, to answer that question, I get everything. You name it, I've heard of it. And I was blessed to actually have, when I was in my final year at chiropractic college, 2 extra clinicians. So I dealt with the autistic, developmentally delayed kids and adults. And I also had the option of working with the Native community. So I was downtown Toronto on the streets that, let's just say, people want to get something.
um,
And I had a lot of those people as my patients too. They are people. And actually, I remember one particular situation when I was downtown Toronto that, I mean, I think I'll cry if I tell people this story, but this is where I understood that we're all just trying and doing the best we can with what we
mhm,
have and what we know.
right.
And so I was at this downtown clinic and I'm walking back to the car, and usually I was with a guy that was in my clinic with me, but he had
Mhm,
to leave early that day. So of course I'm leaving at like 8 o'clock at night when it's dark,
mhm.
and there's a prostitute on the street and there's a guy following me. And she actually went out and she knew who I was. And she's like, you just keep going to your car. I'll take care of this. And she told the guy, no, like nobody touches her. She's my, healthcare provider. Nobody touch her. And I'm thinking to
Wow.
myself, that's incredible. Like, you sleep on the streets and I know that. And that's like, I was like, and I'm rushing to my car because I'm scared. There's this guy following me and I don't know what he's going to do. And she totally stopped him. And that changed my whole perspective from that point onwards. I just thought it was incredible. I was like, everybody can help each other.
Yes, that is a beautiful story. You brought tears to my eyes because yeah.
Yeah, actually, I can't believe I got through that without crying. Because I have for the longest time, because I think about her even to this day, because I thought, you have, everybody's looking at you just with one thing and making a judgment.
Yes.
Here I am with you, like, you're strong, you independent, you understand. She even said to me as I was walking away, she whispered, you go at it and do that. I wish I could do that. And it's like, well, you can do that. I just think that you're stuck in a certain spot. Not that I'm going to have that conversation with her when I'm walking to my car,
Right.
but these are things I thought of after. And it definitely shaped me and my understanding of how I work with patients. Like, I don't want somebody to judge me. Why am I judging you? So if there's something you want to do, I'm going to work with you on that.
Nice.
Yeah.
Nice. So what are some of your pressing business challenges right now?
Okay. So first off, when you run a business, there's almost everything that's pressing. But currently my biggest challenge is trying to find an associate, somebody with the same mindset that, would like to have a more general wellness preventative practice and work with me, because as you know, I'm like fully booked. I don't like to cut back hours even though I'm tired, because I like to help everybody, obviously. So if I can find somebody right now, that's my biggest pressing challenge.
That's a good problem to have.
Yeah, it is.
For the world in general, I mean.
Yeah.
Because that means that there's lots of people that are getting help and looking for help.
Yeah, absolutely. And that's what we'll expand on that, I think.
Okay.
But yes, that's where the whole working alongside a lot of other health professionals, I think it's so important, because it's not just one thing.
Mm-hmm.
Yeah.
Yes. Okay. So let's talk about what gives you the most joy or excitement in your business. What's some of your wins? Although I know we've already been there, but let's keep going because
lots of wins. For me, I think the biggest one though is when I get patients that tell me they sleep better. For me, that's the biggest one, because I deal with a lot of concussions too, and I know those people don't sleep well.
Right.
I actually have a few patients with PTSD. That's the one I'm researching right now, because it irks me that I have one patient that doesn't sleep well, and I'm still researching it for her. Because usually I would say about 95% of the time, clinically, patients will tell me they sleep better after an adjustment, which is great. And that's most of my patients. So when I have somebody who hasn't slept in a really long time and they tell me they slept and woke up rested, there's a difference between sleep and rest.
Yes.
So when somebody tells me they're rested, I'm like, yes, I know that we're getting to the nitty gritty, because now they've had a chance to start the actual healing in their body. Yes. And that for me is so satisfying, because I know that now they're on whatever journey they want for recovery. When somebody tells me they sleep better, I know I've done my job.
Nice.
Yeah. Well, that's the biggest win for me.
Yeah. And I can so agree with that, because I have so many people my age who think that, well, I don't sleep well, and it's just like that's a normal part of aging. It's like, no.
Do you want the stat on that? In the United States, they did a statistic on how many adults have sleep issues. It's 3 out of 4, 75%. I think that's normal. I know. I'm like, oh, no. You should be sleeping well.
Yes. Well, and again, this is your body's time for regeneration, right? How do you? Yep. Exactly. Never mind the psychological, mental effect that not sleeping has on people.
Yep.
Wow. 75%. That's criminal.
Yeah. Well, that's what the statistic says. Yeah. I don't know if there's an updated one for this year, but the last time I read it, which was a few years ago, it was 75%, 3 out of 4 people.
Yeah. Well, I know that a lot of people that I talk to, like I say, they don't sleep, and they just say, well, yeah. I have people who'd say, I haven't slept. I had a friend who told me that. She said, I haven't slept well in years and years and years and years and years. And I was just like dumbfounded.
Yeah. Oh, I get that from a lot of patients. That's why I think that one's the most satisfying. Because even though, these are a couple of biased philosophies by me, just with all the different things that I study. Right. Rest is very spiritual. Sleep is very physiological. Just the body needs sleep. Yes. So that's why for me, when somebody says I'm rested, it's like, yes, because you should have everything that you believe that you should have, and your dreams should come true. So the more rested you are, the more just innately I feel that person has finally almost come to fruition, I guess.
Right.
Yeah.
Right. Beautiful. Okay, so others starting out in your line of business, give us some advice. Again, I know you've already touched on it.
Okay,
But
so number one, you have to be congruent. You have to be congruent. So if there's something that you believe in, you got to be congruent with it. So for example, I love Halloween. Don't get me wrong, I love candy. And yes, it's not very obviously balanced diet,
right.
but I do believe everything in moderation.
Mm-hmm.
But at my clinic, am I going to hand out candy during Halloween? No, that's not congruent. Right. I do the little Halloween pencils for the kids and decorate the clinic. Like that's just an example. But I think the biggest thing is that you need to be congruent and you need to set some boundaries, because my patients know I'm around a lot and my second home is the clinic, but there are times that I just cannot stay late because I'm exhausted and I have to make sure I fill up my cup so I can help everybody else as well. Yeah. And I think that's the biggest thing with the next generation, because they'll switch hours or be available on a Sunday and then not be available. It's like, just set what you need, set the boundary, and then be congruent with what your philosophy is, and everything will work out.
That's really good advice.
Oh, thanks.
Yeah,
I worked at it.
That's congruency to me. That's a really big thing too, because I spent a lot of years working in jobs where I didn't feel like I belonged, and that's really hard on you, not just physically but mentally and emotionally, right?
Yep.
Because it feels very much out of your, again, you feel very much out of alignment. Pardon the pun.
No, and I love that. To expand on that, so for example, the laser. Well, the laser is considered actually to a certain degree a medical treatment. But since I don't really treat anything and I'm helping with function, my patients know that it's an adjunct. It's not the number one.
Right.
So if we're meant to be healthy in the first place, hopefully you don't ever need to use it.
Right.
But when something does occur, then why don't we supplement it and allow that to heal faster? Mm-hmm. So it's just a matter of being congruent with how you present that as well.
Right. Yes.
Yeah.
And yes, the laser is, it's the way of helping the healing along, right? And an additional tool, not, it's not like you're saying,
absolutely.
Okay, well, in the meantime, let's see about getting you a prescription for painkillers, because, right, it's like that would be out of congruency with what your philosophy.
Yep.
Okay, so let's talk about collaborations again. I know you've already touched on it, but more.
I actually collaborate with a lot of people. And the funny thing is, there's even physicians like general practitioners and surgeons in Edmonton that know who I am, and I know who they are. We just actually haven't ever met because we have mutual patients. Right. And that's why I wanted to tell you that it's so nice that they're starting to actually, I guess you could say, be okay with patients seeing chiropractors, because I know that it hasn't really been like that before, but it seems to be a lot better now. I even have neurologists that work with me as well, because we have mutual patients. And it's interesting because, I know they know of me. I know of them. I just haven't met them.
Right.
So I definitely work with a lot of neurologists. There's some orthopedic surgeons I work with. There's also general practitioners in the area, more West Edmonton, because that's where I work. And then obviously midwives, doulas, and lactation consultants. Almost every one of them will know who I am, because I am certified in pediatrics and pregnancy. So they know that if they send somebody to me, I'm going to do my due diligence on that.
That's nice.
Yeah.
That's really exciting, because I mean that's where I believe the future of healthcare is, right? Which is what I said in my introduction, right? It's like, this is about cooperation and collaboration, right? Because we all want the same thing. We do. I believe that, right?
Yeah, absolutely.
And so how do you get there? You get there not by tearing each other down. You get there by building each other up and helping each other along. Nice. So how do you currently market your business? I know you said you're quite busy, so I don't know how much marketing you're doing. But...
So I was thinking about that. We did tons of marketing at the beginning, but now it's all word of mouth, because there's so many patients that refer other people in. I honestly, I don't even think we've done marketing within the last year. I've just been so busy. At the beginning, marketing was everything. I used to go door to door with flyers just so people knew who I was in the community. But I mean, I was, as you know, I'm compassionate. So I want everybody to know that I'm there. Yeah. That's how much I actually, and who does door to door really anymore? Other than, I mean, the election was coming up, right? We got door to door for that. Yeah. Just saying.
The weed guys.
Yeah. That too.
The lawn weed.
Yeah. And then obviously for marketing as well, I mean, there's different things that you can do. That was more external marketing. I mean, I did do the coffee news at one point, more external marketing. And
Mhm.
then I would say more internal marketing is all my educational material for patients. So that's ongoing all the time.
Right.
Because if there's new research or something else coming out, I have all that always printed for people, or, it's available if somebody wants to read up on it.
Right.
Yeah.
And that to me is such a critical piece too, right? Because typically, in years gone by, when you went to the doctor, or you went to a medical professional, they were essentially saying, well, this is what you need to do. And the education really wasn't necessarily a critical piece of it. And yet really, if we are going to be responsible and accountable for our own health, we need to be educated, because otherwise, how do we know, right?
Yep. Yeah, absolutely.
So what are you seeing for the future of your business? I know you're doing training.
Oh yeah, I do lots of training.
Yeah.
So for me, actually, there's two big things, and I still waver on it. And how you have a dream and it's still melding a little bit. That's where I'm at.
Uh-huh.
So right now, I have another 5 years on my lease at the clinic, so I'm going to be there. But my ultimate dream is to actually set up a combination of an actual chiropractic institution in West Canada, and an addictions facility, because Canada is very far behind on how to treat an individual with addictions compared to the research coming out of the United States, that is. So my biggest thing would to start that up. Now, how I get funding for it or who I meet, I don't know. I'll leave that up to the universe.
Yeah.
But that's my ultimate dream, because I do want to go more into the teaching, because I feel like I don't know what it is right now, and everything passes. I understand that, but there just seems to be a big push for like research, when
Mm-hmm.
it should be about the patient and even your clinical experience, right? Like if I know that if somebody tells me there's something going on, and in my experience, the last 10 years, this has worked, but the research goes, that may not work. Well, why wouldn't I let my patient know about it?
Yes.
Right. And I think that there just seems to be a real discussion about that when it should be patient centered.
Yes. Well, that goes back to the point that you made earlier when you talk about the whole bit about like science backed and this kind of thing.
Yeah.
Is I get all of that. I do. I get
Yeah.
all the numbers. But again, we're all so individual that
Oh,
what I
absolutely.
need isn't
Yep.
what Buddy next door needs, right?
Yep.
And so
Absolutely.
how do you put together research on that?
Yeah, you can. And that's why I'm saying, like, we just keep researching and researching, right? And
Yeah.
I think too, because me, I like to look at more than just one point of view.
Right.
So, I mean, currently, like, I'm studying traditional Chinese medicine.
Mm-hmm.
I studied addictions and got my physician of addictions through the American College.
Mm-hmm.
And then I did my pediatrics and pregnancy. Now I'm studying a little bit of Hindu, Buddhism, and Taoism,
Uh-huh.
because those philosophies are
Right.
incredible. When you start looking at it and then looking at quantum physics, I mean, in
Oh,
2015, there
yeah.
were like two guys that did a research article finding out, there's studies on consciousness. And I don't even think people know that there's studies on consciousness. And
Mm.
they think that the consciousness is in the microtubules of the brain. That was their conclusion. They're not sure. Who knows? Because research is research.
Right.
But then I'm thinking, if you understand the network of the brain and the spinal cord, then it would make sense that when we do an adjustment, and Heidi Havoc is doing her research right now, that you see the prefrontal cortex light up on an MRI.
Mm.
I was like, that's awfully interesting, don't you think?
Yes.
But do we have a conclusion, or are they talking to each other? I have no idea.
Right. It's interesting because as you talk about that, it's like I kind of got chills up and down my spine.
I know, right?
Right?
It's so interesting.
It
It's
is.
funny too, because I've talked to a few patients, and it's like, because I have some patients that are very left brain. I want the research on this, Dr. Natalie. Okay, interesting. I'm going to show you an example. If I cut off your head, do you think the rest of your body is going to work? No, it's probably not going to work, because we've seen that for the last couple thousand years.
Yes.
So there's a little bit of science for you.
Yeah.
But if you cut it off, I'm pretty sure the circuitry is not there. So there's got to be something going on. That's the gist of it. And then, I mean, and I'm just kidding a little bit with that too, right? But it's putting it in perspective. I mean, how nitty gritty do you want to get when globally we know you cut off somebody's head, it's not going to work.
Right.
Yeah. Sorry, now I'm going on a rampage. You got me excited.
That's a little bit extreme, but yes, I guess.
Yeah. I hope everybody had a good, visual on that one.
So, okay, let's touch on this because I know you brought up some names here already, but source of inspiration in your life. Let's go back there.
Oh, source of inspiration. I mean, almost everybody that I meet.
Right.
Is that the interesting thing too is when you look at it, I don't know why as a human species we always seem to look at the negative first and then the positive. I don't know why we're wired certainly like that a little bit. So I was looking back and I mean there's lots of brilliant people that I look up to. Some of them are already deceased, like
Right.
Hippocrates, D.D.
Yeah.
Palmer.
Yes.
And then I also look at what's going on right now. Like Heidi Havoc is brilliant. Monica Berger is brilliant. There's other chiropractors that are brilliant. And then I look at some of the people that aren't in my profession that I think are absolutely brilliant as well.
Mm-hmm.
There's some medical professionals that are doing actually amazing research that I think is going to help us
Right.
that I've never met before. But then I look at the small people and the ones that maybe I didn't get them to where they wanted to be, which I'm really hard on myself though, because most patients say they feel better. But I look at that and go, okay, what can I learn from this experience too?
Mhm.
So for me, every single individual that I meet is an experience. So I mean, it's tough for me to say exactly who the best person is because I can use so many different examples in my life.
That's a beautiful example. The whole thing about everybody inspires me just in their own way.
Absolutely. Like even, getting little kids that I mean, I had a little girl, she was 2 years old, and this happened last year. I haven't seen them since because I know what I do and I know that it works. I mean, and you really have to, understand that and tell patients. And I thank them so much for trusting me when I give them that information.
Right.
And I told the mom, just give me at least 8 visits because it was actually a nurse at the Stollery that referred that little girl to me, which I
Okay.
thought was huge. And so, I helped out. The mom noticed, and the neck pain was the actual issue in a 2-year-old. There shouldn't be any neck pain there.
Oh, yeah.
And so, I did the adjustments. She would always feel better, and then it would go right back. And then there was one day she came in, and I started doing some stuff, and I was like, at this point, it should hold. Like there should not be an issue after this, and I can tell you that for sure because I know what I do. And she brought her in the very next day so I could double check, and I was like, nope, I'm sending you to the Stollery. I said, there's something else going on. Even all the clinical tests are negative, but there's something going on because I know what I do.
Mm-hmm.
So I don't care if I have to go to the Stollery with you. There's something going on with your daughter. And they wouldn't do any extra testing because as a 2-year-old, I don't know what they do at the hospital, but I think that's why the nurse referred her to me.
Mm-hmm.
I said, go back and I will go there with you if I have to get some extra testing done. And so she sat there all night and then called the clinic the following morning and said, yeah, they finally decided, since I told them some stuff that you told me, to give her a CT scan. And unfortunately, she had a brain tumor.
Oh.
So the good news is they found it.
Right.
And, the good news is that I really, really am thankful that mom trusted me when I told her I know what I do. And at this point I should see, something.
Mm-hmm.
And we didn't see what I would like to see. And she went back and fought for it and she got what she needed.
Nice.
So that in myself is a huge collaboration too, for that nurse to know who I am and go,
Mm-hmm.
go see Dr. McLeod. I don't know what she can do, but at least, go.
Mm-hmm.
It helps out because at some point something would have happened maybe later on and she would have never known.
Right.
Right. And as a mom, I would think to myself, well, that's terrible. Like I tried everything I could and, maybe nobody listened type
Mm-hmm.
idea, depending on where her mentality is.
Mm-hmm.
So, I mean, I think that's a huge example of how we are starting to collaborate with each other. And I'm really happy that that little girl taught me a lot too. And she's still in my mind when I see a lot of kids.
Mm-hmm.
And that's just one example. I can use a whole bunch of different examples. That's the extreme example. Yeah.
Well, I'm sure that mother was very thankful.
Oh yeah. I'm hugs, crying. Usually come to the clinic when it's a little bit quieter. That's because when all the adults seem to come together and then all the kids come together. It happens like that, which is really interesting because your day is never the same. And I love that. But there's always like half an hour to an hour. It's like rambunctious kids. And then like an hour of people coming after work and it's quiet and you can hear yourself think.
What energy. That's interesting. Okay. So tell us then how people can get in touch with you.
Oh, well, obviously calling the clinic is huge. We have a Dr. McLeod Facebook page and a Dr. McLeod Instagram, which I'm happy to say is where I'm going to start getting out more educational material. I started a YouTube channel, but it seems to be, I don't know. We're still working on that one. So I'm
Right.
going to try Instagram a little bit with YouTube. Excuse me. So calling the clinic is huge. Emailing the clinic is huge. Those are the biggest two to get through to me.
Can
I don't
you,
give out my personal number.
no, don't give out your personal number. Give out the clinic number and your email
Yeah.
address.
Oh, do you need it?
Well,
Oh, so the
give
clinic
it out.
phone number. Yeah, the clinic phone number, 780-756-9506.
Right, right.
And then the email is info@drmcleodchiropractic.ca.
Nice.
So if you spell out Dr. McLeod Chiropractic or, chiropractic and you see Dr. McLeod there, everything's online.
Right. Yes. Yes. I know you're easy to Google because I think that's how I found you originally.
Yep. My husband works on those engine search optimizations.
Oh, there you go.
Yeah. I guess that goes under marketing, right?
Yeah, probably. Okay. Well, awesome. This was so much fun. I learned a lot about you that I didn't know. This is quite interesting. But I really appreciate
Oh, good.
you because again, it's like people. This to me is another option for health that I want people to know about.
Yep.
Awesome. Okay. Well, thank you very much for being my guest this week. Thank you for sharing all of your stories. Thank you.
Well,
for
thank
sharing,
you.
Yes, and thank you for being vulnerable. I know that sometimes it's a little bit, like you say, some of those stories you were close to tears. So was I.
Yeah, no, those, like I said, everybody shapes it. I just use the extreme examples. If people want more, low key examples, I can give those too.
Well, the extreme examples are the ones a lot of times that touch our heart. And
Yep.
again, one of my thoughts behind putting together this show is again just letting people know that these options are available out there, and
Yep.
and again that they're not aware that, like I say, back when I was pregnant, I would have never even thought of going to a chiropractor. I just thought I was just pregnant, which I was, but
Yeah.
any case, thank you very much, and thank you to everybody for joining us this week. We love sharing knowledge, we love sharing strategies. As always, we appreciate your feedback, so if you enjoyed the show, please let us know and then spread the love and tell your friends. If you have a suggestion for someone that you would like to see on the show, please email me at benita@thehealthygorilla.com. And then coming soon to my website is 15 easy hacks for more visibility, more clients, and more income for natural health businesses. And then join us again next week, and let's keep this natural health movement going.